People will commonly ask what's the latest and greatest treatment for prostate enlargement. And the answer is it really is dependent upon where you are in the symptom spectrum, and also what degree of invasiveness you're willing to tolerate. Treatments range anywhere from medicines, which will either relax the tissues of the prostate to allow you to pass your urine more freely, or it could potentially be medicines that would shrink the prostate over a period of time. And these are good for people with mild symptoms. It will commonly get people back to a point where they feel like those symptoms are very tolerable. The next set of treatments are what are called minimally invasive therapies for the prostate. And there's essentially two of them that I think have gotten a lot of popularity. And one of those is something called Rezūm, R-E-Z-U-M, which is a steam treatment, which with the patient sleeping, you inject into the tissues of the prostate steam, which will ablate the tissue or shrink the tissue in the area of the prostate. And it helps to open the channel and create a more free flow of urine through that area. The other treatment that's sort of similar to that, but is a little bit more extensive in terms of its ability to remove the tissue in there and to open the channel, is something called aquablation. And essentially what that does is it's a high pressure water jet that moves back and forth through the tissue and opens the channel. Generally it's the channel within the prostate that opens an area that the urine can then easily pass through and can get the patient a much better urinary stream, and also then a reduction in symptoms. One of the ways that I often describe to patients to think about the treatments that open up a channel within the prostate, they are sort of like, if you think of the prostate as an apple, it's sort of like coring an apple. It's opening a channel up in the central portion to get the urine to pass easily through. There are some other somewhat more invasive treatments for the prostate, including one called Holmium enucleation or laser enucleation of the prostate. That is a little bit, to extend our fruit conversation, is a little like peeling an orange from the inside. You remove a very large piece of tissue from the central part of the prostate, and it does allow for a large amount of urine to move through that area. That's very good for people that either are unable to pass their urine at all, or people who have very large prostates where you need to remove a much larger piece of tissue. So really the key to prostate treatment is tailoring it to the patient, to making sure that we are doing the right procedure for you. And one of the things that I think is important for patients, that the newest treatment is often the best treatment for them. Sometimes the newest treatment isn't the best treatment for them. And that individualized, personalized discussion of your own symptoms, the size of your prostate, and also your tolerance for side effects and what your expectations are a critical part of answering the question about what procedure is right for you.